Hi guys, today we'll be having a look at acute respiratory responses. That means that your respiratory system, that means your lungs, will actually increase their functions when you exercise. So what we'll have a look at is the changes that happens to that when you begin to exercise at submaximal levels and also maximal levels. So the 4 different changes we'll focus on is respiratory rate increase, tidal volume increase, ventilation increase, and diffusion increase. Okay, so respiratory rate means just the breaths that you take per minute. So if you think about exercising, when you actually go for a run or you start to play a sport, your breathing actually begins to increase, and that's just called respiratory rate. So there's some examples on the screen there for you. So if you are just sitting there watching TV, you're probably likely to do about 10 breaths a minute. As soon as you start to get up and start walking, gentle jogging, for example, so submaximal exercise, that will actually increase to about 25 breaths per minute. And if you start sprinting, that will increase again to about 50 breaths a minute. Now, tidal volume is a little bit different to respiratory rate. Tidal volume means that you are measuring the amount of air that is coming in each breath. So that's measured in litres. So we look at litres per breath. So again, for example, when you're resting, you're just sitting there, gentle activities, you will probably consume about half a litre of air per breath, or not consume, just take in. And that also really doesn't increase too much when you start submaximal exercise. That will go up to 1 litre per breath. When you begin maximal exercise, for example, though, it could possibly go up to 3 litres per breath. Now, it really depends on how fit the athlete is. You can improve on these figures if you obviously do aerobics training, but these are sort of general figures for the general population. And ventilation, that is a combination of respiratory rate and tidal volume. So you're looking at how many litres you breathe, but per minute this time. So I've got some equations there. It looks a little bit confusing, but just bear with me. So the first example there is you've got 5 litres of air per breath times 10 breaths per minute, and that will equal 5 litres of air per minute. And that's just when you're resting. So when you sit down, when you're in class, just sitting on the bus, whatever, playing on your phone, you're breathing in 5 litres of air. That's not pure oxygen, because the atmosphere is not oxygen. That's just air. So the amount of air that goes into your lungs when you're resting is roughly 5 litres each minute. That takes a massive jump to 150 litres a minute at maximal exercise. So your body obviously needs a lot more oxygen when it's exercising. The working muscles need oxygen to produce that ATP. So there's a possible 3 litres per breath at possible 50 breaths per minute. It depends again on how fit you are, what your respiratory function is like, whether you've got asthma, whether you smoke. Those sorts of things depend on how much air that you take in. So that could possibly be 150 litres per minute. Again, it's sort of for general population, so who knows what elite athletes could have. It could be higher, it could be less, particularly if you've got those respiratory issues like I mentioned earlier. So we've got a picture there of alveoli, or alveolus, sorry, which is single, alveoli is plural, and I've got some arrows pointing to the actual name. So the air sac is the little blue bubble, I suppose, and that's within your lungs. So if you go to the most minute level in your lungs possible, then you're looking at the alveoli, and that's where air diffuses, or oxygen and carbon dioxide diffuse in and out of the lungs. So you've also got an arrow pointing to the oxygen, so that's going from the atmosphere into your lungs and then diffusing into your bloodstream. You've also got carbon dioxide coming out of the bloodstream and into the alveolus. So what happens is when you're doing exercise, that rate of diffusion, so the rate of the gas transfer, actually increases quite a lot. And the reason for that is because your muscles will actually need more oxygen. So then all the organs respond to that. In this case, the lungs say, well, we've got to get more oxygen to them, so we'll allow diffusion to increase a lot more than what was happening. The thing is, though, that the lungs can have particular limits. I mean, if you're doing exercise and you smoke, for example, then rate of diffusion won't be able to increase as easily as it would in a non-smoker. And also the amount of oxygen that travels through your blood will depend also on your hemoglobin levels. So it's a bit tricky to say whose levels of diffusion will increase and how much, but for purposes of your exam study and also just content knowledge, what you need to understand is as soon as exercise increases, so do levels of diffusion. Okay, so just in summary, you need to understand that all the functions increase in the respiratory system, and that basic reason is to supply the working muscles with more oxygen. You've got respiratory rate, which is breaths per minute, tidal volume, which is liters per breath, and then the combination of those two is ventilation, and that's liters per minute. I hope you understand those concepts. They're pretty basic. Make sure you check in for the cardiovascular system and also the muscular system changes. Thanks for watching.